I'm Dr. Nirvana, and today I want to tell you about a patient who came to see me because she had a very strong feeling that something was being missed. She suspected she might have H. pylori. Now, she wasn't walking into her doctor's office demanding a diagnosis. She wasn't saying, I know I have this and you need to treat me. She simply wanted to be tested and wanted an answer. But when she asked her doctor about ordering the test, she was told they didn't think it was necessary. Unfortunately, I hear this way too often from my patients when I first see them in office. And this is where I think the conversation gets super important because what do you do when you're the person living in your body every single day and you're telling someone and asking them something doesn't feel right, but the person you're asking for help doesn't think it's worth looking into? So today I want to talk about why I believe you should be able to ask questions about your own health, why testing can sometimes give us valuable clarity even when it doesn't confirm what we expected, and why I don't think you should feel embarrassed for wanting to investigate something further. Because this patient's story is about much more than H. pylori. It's about being heard. When she came to see me, she explained why she had become concerned about H. pylori and why she wanted to know whether it could be contributing to what she was experiencing. And my response was very simple. Let's test for it. Because if you've been thinking about this, you've been researching, and you feel there's a reason it might be relevant to your symptoms, I want to understand why with you. That doesn't mean I automatically assume you have it. It means I'm willing to investigate it with you. And sometimes I think there's a misunderstanding around testing. Test doesn't only have value when it comes back positive. Sometimes a negative result is incredibly useful because now we've ruled something out and we can stop wondering about it. That gives us direction. It allows us to say, okay, this probably isn't what's driving the problem, so where should we look next? And to me, that's very different from never looking in the first place. If you've been dealing with symptoms that seem completely unrelated, your gut may be the missing piece. I created this quick 2-minute gut health check to help you see whether your digestion could actually be driving more of what you're feeling than you realize. You can download it for free in the description. The reason I bring that up is because digestive symptoms aren't always as obvious as people expect them to be. Sometimes a patient comes in saying, my stomach just hasn't felt right for months, but what they really mean is that something about their digestion has changed and no one has helped them figure out why. Maybe they've already tried changing their diet, or they've taken supplements and they've been told to take an antacid reducing medication or simply avoid certain foods. But the question is still sitting in the back of their mind. Why did this start? That's the part I'm interested in. And when a patient asks me whether we can test for something that could potentially help us answer that question, I'm generally very open to doing that. I don't want you walking away from an appointment thinking, I wish they would have just checked that, because that uncertainty can stay with you. And I hear versions of this from patients all the time. They'll say, I asked whether we could check this, but my doctor didn't think it mattered. Or I brought this up and they said it probably wasn't necessary. And maybe sometimes the doctor is completely right. That particular condition may not be what's going on at all. But if the test is reasonable and appropriate, I think there can be tremendous value in getting clarity, because medicine shouldn't be about proving the patient wrong. It should be about figuring out what's actually happening. And there's another part of this that I think is important. If you've spent months or years not feeling well, you start paying attention to your body in a way you probably never did before. You notice patterns such as which foods make you feel different, or you notice when symptoms show up, and you notice what changed before everything started. And while that doesn't replace medical training, I do think it matters. You live in your body. So when you tell me, I really think we should look at this, I want to know why you think that. Sometimes you may have noticed something that gives me a completely different way of looking at that situation too. Other times we'll test it and find out that it isn't the answer. That's okay too. We learned something, we narrowed the possibilities, and now we can move forward instead of continuing to wonder. That's actually a huge part of how I approach patients in my practice. I don't expect you to come in knowing exactly what's wrong with you. That's my job to help figure it out, but I do want you involved in the process. If you've read about a test and you want to know whether it makes sense for you, ask me. If there's something you've been worried about, tell me. If another doctor told you something wasn't worth investigating, but you still don't feel comfortable with that answer, I want to hear why. Because sometimes the issue isn't even the test itself. Sometimes what you really need is for someone to slow down long enough to explain why a test would or wouldn't be helpful. That conversation matters so much to me. And I never want you to feel like asking for more information somehow makes you a difficult patient. It doesn't. Wanting to understand what's going on in your body is reasonable. This patient wasn't asking to be treated for something she hadn't been diagnosed with. She was asking for information. She wanted to know whether H. pylori was there or whether we needed to look somewhere else. And once we have that information, we can make a much more thoughtful decision about what comes next. That's the kind of medicine I believe in. Not guessing, not dismissing, not assuming that a patient's concern isn't worth discussing. I'd rather have the conversation with you and decide together whether testing makes sense. And if you've been dealing with digestive symptoms or symptoms that don't seem connected, this is also a good time to take my free 2-minute gut health check. If you've been dealing with symptoms that seem completely unrelated, your gut may be the missing piece. I created this 2-minute gut health check to help you see whether your digestion could actually be driving more of what you're feeling than you realize. You can download it for free in the description. Sometimes just seeing your symptoms together in one place helps you recognize patterns you hadn't noticed before. And that can give you a better starting point for your next conversation with your doctor. And that's what I want you to take away from this patient's story. You don't need to walk into your doctor's office with all the answers, but you should feel comfortable asking the questions. You should be able to say, can we look into this without feeling dismissed? And you should leave understanding why something is being tested, why it isn't being tested, and what the next step is if you still don't have an answer. I'm Dr. Nirvana, and one of the foundations of my practice is that I want you to be part of the conversation about your own health. Many doctors treat symptoms. I treat the individual because you deserve to be heard. If you've ever asked for a test and felt like your concern was dismissed, tell me about it. I want to know. I think a lot of people have had this experience and never realize how common it is. And if you want more conversations about gut health, thyroid health, hormones, and why you may still feel unwell, even when you've been told everything looks normal, subscribe to the channel. You know your body better than anyone, and you deserve a doctor who's willing to listen.